Beyond 50 radio program. I'm Daniel Davis. Well, now that we're here in the new year, 2016, I'm sure many people have as part of their New Year's resolution a better body. A body that's healthier, one that doesn't get sick, and certainly with growing in age, aches and pains need to be disappearing as well. Joining us here on the Beyond 50 radio program is Ronnie Weir. He's spent the last decade teaching health and wellness around the country with the use of what is known as a low-level laser therapy. It has helped to develop techniques and protocols for the use of low laser therapy for the home and professionals. He also teaches on becoming a healthier you by being responsible for your own health and wellness. I'd like to welcome to the Beyond 50 radio program today our guest, Ronnie Weir. Ronnie, thank you for joining us here on the program today.
Thanks for having me. I really appreciate it and look forward to helping anybody we can.
Now, obviously, you came into the health and wellness industry because you probably weren't feeling so healthy at a particular time in your life. Tell us about that.
Yeah, it's always crazy how you get involved in particular things in your life, and I certainly believe there's a plan for that. And I was sick with Hodgkin's lymphoma when I was a little younger, and developed that, and stage 4 cancer basically, and didn't have much of an immune system, and really wasn't paying much attention to my health and wellness at the time. And that's kind of what drove me into health and wellness, to think differently about health and to be able to really take charge and be more responsible for my own body and my own health, and pay attention to different signs and different things that I could do to prevent disease and illness and sickness and all of those things. So that's really what drove me, and learning a lot going through that in the medical field and just in general in health and wellness and staying active.
Now, I have to ask, since you did a lot of research in this, obviously you were very passionate about discovering the right answers for going a good direction for optimum health. For the mainstream kind of message that you see out there, were there any surprises that had sort of a negative impact when you discovered, well, wait a minute, what they're saying out there just doesn't seem true?
Yeah, the biggest things that I learned really quickly is that it's just too easy to provide a Band-Aid, if you will, to a situation, whether it's to a lifestyle choices or to medication we're taking, things like that. And the biggest problem that I saw was it was just too easy to get put on different medications and drugs and for everything, and the complications internally when you start studying the body and the negative reactions that can happen internally. The average drug has around 70 side effects internally when you're taking it, and that's certainly not good, not healthy for the body to do that always, and certainly to do it long term most of the time. And so those are things that really opened my eyes, is all the negative side effects, although there's some positive things in the pharma world, obviously, but certainly being careful and being more aware of some of that, I guess, is what happened to me.
Now, how did you come across this lower-level laser technology?
Well, actually, I got introduced to a doctor who had invented some tremendous things, including a low-level laser out here and around the country, and really started researching that as well, and went into some consulting for doing some writing and different things for them, and then ended up really selling and distributing and educating and teaching low-level laser therapy and health and wellness and energy medicine around the country. So kind of dove into it, became more of an expert on it, used it, researched it, taught it, and just really started diving into what works and what doesn't work, and how it works and the whole bit, the physics of it, and just learned a lot in a hurry.
Now, it's pretty interesting to see that we have more and more this day and age of what you would call non-invasive ways of being able to heal, and this is certainly one of those, isn't it?
Yeah. Yeah, you look at today, and I think people are getting so much more responsible about what they're putting into their bodies, what they're breathing, what they're doing when they go to the doctors, and using alternative care, chiropractors, massage therapists. people like that, acupuncture, and certainly understanding that the body is designed to heal. The body's designed to heal itself if it's given the right energy, the right environment. Sometimes it needs a boost or aid in order to do that. And if you have a balanced body, balanced immune system, nervous system, you're certainly going to be healthy. So today, everywhere you turn, every newspaper, every magazine, everywhere you go, you're going to start hearing, if not already, you're going to hear about low-level laser therapy and what it's changing, and not just the medical community, but really more in the home and designed to use in the home.
Now, how does this, what exactly does it do for people if they decide to move in this direction for healing?
Well, low-level lasers are pretty special, and a lot of this has been around and talked about since the 1900s, back in Planck and Einstein in the early 20s. He won the Nobel Prize in 1921 for his photo theories, and his experiments. And 2 years later, Robert Millikan won the Nobel Prize for his photon experiments, which is light experiments. So low-level lasers produce pure light energy, photon energy. And a photon is a small packet of light that just carries information. And it can carry frequency. It can carry electrons and move that around. And basically, it's going to re-energize sick, injured, damaged cells. Anytime you have disease or illness or injury, your cells in that area are not all healthy anymore. And when they replicate unhealthier cells. And so you have signs and symptoms of disease. Light, actually, pure light can help open up cells and allow better protein synthesis and nutrient uptake, oxygen binding, even atomically getting to the electron transfer back into that area of the body. And so you really increase ATP, your adenosine triphosphate, the energy of the cell, and allows your cells to repair, replace damaged cells, and to become healthier. The body produces light called biophotons from cell to cell to cell to cell instantaneously. And when you have disease or illness or injury, you disrupt that light and that biophoton emission. And certainly that causes other issues and doesn't allow the body to do what it's designed to do. And to heal and to heal quicker and to repair and replace like it could and should. So using laser, you're basically re-energizing those cells. On the outside, to just a general person, it's really some basic things that you're doing that are just incredible to enhance the body. You're stimulating blood flow, for instance. Without adequate blood flow, you can't heal in an area very well. Whether it's a broken bone or a wound or post-surgery, scar tissue that's built up, without adequate stimulation of blood flow and or increase of circulation, the body doesn't heal as well. And, of course, you don't get oxygen to the cells like you need as well. It also reduces inflammation. So anything with itis, joint problems, and, of course, a lot of arthritis that you see today, it reduces inflammation up to 75%. So huge for anything with itis that you're working on and that you have pain or mobility issues with. And then just really helping with pain. Low-level laser can actually stimulate endorphin production, which is your body's own morphine, and allow you to deal with pain naturally versus constantly taking a pill to deal with pain, which is obviously hard on the kidney and the liver and things like that. So those are some of the main things that low-level laser can do. Because it works at a cell function level, the long-term usage and benefits and prevention-oriented focus can be very beneficial to anybody.
Mm-hmm. Now, what's really fascinating about this is to know that the technology has been around for more than 50 years. Yeah,
it's the first laser came back in really the early 60s, and is really when the first laser was made in 1960, and then of course the diodes didn't come out until 1982. What you see more of today, the true laser diodes. And so a lot of this has been around for quite a while, and a lot of people may have not heard of it or may have heard of it. And again, anytime you're opening up a magazine or a medical article or a journal or a newspaper, you're going to hear about laser therapy in some way, shape, or form. And there's, of course, many forms or several forms of laser therapy, whether it's hot or cold laser or just light-emitted diode LEDs or true laser, true medical lasers.
Now, is this a very safe therapy for people to use, and are there age limitations or restrictions?
There really isn't. It's very safe. Most lasers, and again, the problem just in general is if people aren't educated a little bit on what is laser and what is not laser, and what is safe and what is not safe. True lasers and low-level laser means anything under 1 watt of power, essentially. And that's where you start getting classifications by the FDA and being able to create safety. So most lasers are registered or should be registered for safety and classified as a class 1, 2, or 3 laser. If they're over 1 milliwatt or 1 watt of power, then they're a class 4 device, which is only for licensed professionals and typically things that you do more hotter lasers with. Even things like LASIK surgery are class 4 lasers that are much higher powered. So a lot of this is very safe, and low-level laser designed for the home, most of it is class 1 or class 2, which means it's safe to use just about anywhere in the body, including even in and around the eyes. And some of it, like our company, Infinity Wellness, where we have now Infinity wearable laser technology, which we have the only in the world at this time, allows it not even to be in direct contact, and it goes through a wearable pad, a wearable laser pad that you can wrap and use. And so now you get complete circulation and dosage all around in a joint or wherever you're using it, in the back or the knee or the foot or whatever the case may be. So very important, so very safe. Class 1 is really more like almost classified like a Band-Aid. That's how safe it is. And as you get up the classification, class 3 devices, 3A, 3B, you don't want to use in the eyes, even though if they're non-collimated, it means they don't come to a point, like a laser pointer, for instance. Most people know what a laser pointer is, or in the construction industry, you know what a laser pointer, and it has a pointed beam. It doesn't spread out. It doesn't collimate. And if it's non-collimated light, then great. You get that spread, and you can get speckling, and it's very safe to use anywhere on the body. You don't have to wear goggles or glasses or anything like that with class 1 lasers especially.
Now, when you use this to disperse pain, how quickly and effectively is it for doing that? For especially maybe in situations where pain could be extreme. I might even imagine somebody out there thinking, well, I get migraine headaches. How does it work with that?
Yeah, very great question. We see this often, and of course, some of the biggest things we see today is pain. Joint pain, back pain, knee pain, shoulder pain, arthritis in the hands and the knees and the back or wherever it might be. And it really varies on the person how quickly they respond. One of the biggest problems I've seen in the medical world and community is that they treat everybody identical. And the truth is how we respond, whether it's a drug or another type of therapy, can be individual. And partly how we think and our lifestyle and our choices on a daily and our habits all determine how our body responds to things, negatively or positively for that matter. But when it comes to pain, typically we see fairly quick results on pain. So what we like to teach people is before you laser, do an assessment. On a scale of 1 to 10, where's your pain level right now? Well, it's at an 8, let's say. Great, then laser. Then put your wearable, your Infinity Wellness Laser wearable on, and really over the next 10, 15, 20 minutes, you're going to have a reduction in pain that's very significant. Most of the time, anywhere from 30 or 40%, all the way to 90 to 100%. And it just depends on the person. But the pain will come back in most cases because it's not healed yet, right? You're just starting that process of circulation and inflammation reduction. And it's very exciting to start getting rid of some of that. We see people who've been in pain for years and years and years and couldn't get out of pain, and even they've taken so many pills and drugs that they're just almost immune to it, or it just takes the edge off. And our goal is to really enhance the body's ability to deal with the pain, not just put a Band-Aid over the pain or the symptom. But yes, we want to get rid of the symptoms, but we really want to enhance the body's ability to work on that problem. And that's really what laser therapy does. It really enhances the body's ability to do what it's meant to do. So pain reduction can be pretty quick in most cases. Some cases it'll take 30 minutes or an hour to get 50% or more pain reduction. Just depends on the problem. A lot of people have nerve damage today, and those can be tough. But boy, using laser and being able to go about and stay active, especially with wearable technology that we have today, sure makes a big difference in those kinds of scenarios.
Now, how is this particular thing powered? Is it battery, solar? Do you plug it in? How does it work?
Yeah, our lasers at Infinity Wellness are all lithium-ion battery driven, so they have no memory. They don't produce electricity. There's no electrical output. Just pure light, pure medical diodes, laser diodes. And they use lithium-ion batteries, so you just charge it literally like a cell phone. And our wearable lasers literally will go now about 20 hours without you having to recharge it if you were just to leave it on all day and all night. So we have pads now that you literally sleep on. That is phenomenal to be able to get laser therapy, laser treatment through the night as your body's resting, which is just tremendous for people with back problems or hip problems or lower leg problems.
Now, with this laser technology, it actually penetrates the body through the skin. Is that correct?
Yeah, it will. It's best to use laser directly on the skin, but true diodes will go through pants or a shirt or sock or a cast. If somebody has a cast or wraps on, it'll go through that if it's true laser, and not just an LED technology, and it will travel through that. But the darker the clothing, for instance, and the thicker, the less absorption, the less irradiance you're going to get into that area of the body. So it's always best to do it on skin when you can.
Very good. The reason I asked that is, as you were mentioned earlier in the program about how you were at a stage 4 cancer, is that some years ago I had encountered this Korean massage bed that had these heated jade rollers that would heat and penetrate. Yeah, they weren't lasers, but it was sort of a like acupuncture through heat. And
right.
So they were claiming that, and it was interesting to hear this, that as you use this massage bed, obviously you're laying there to help your back feel better and so forth, but this penetration of this infrared heat was at a temperature of around 109 degrees. And what's significant about that for people who are familiar or may not be familiar with cancer is that it can't survive in temperatures at that level. So you're literally using this massage bed could be potentially preventing cancer. And I wonder, as you mentioned about, people using this at night while they sleep, is that a possibility with something like this?
Sure, anytime, without obviously making claims that I can't make.
Right, I just said, is there a possibility?
Yeah.
I really try to avoid people saying, oh, yeah, it absolutely does this, because then you'd have the FDA and everybody else down your throat. So I totally understand where you're coming from there, but that's why I said, is it possible?
Yeah, and on a cellular level, and when you're talking immune system, which really cancer is an immune system issue, period. And if people have a more balanced and optimal immune system, you're just not going to have signs and symptoms of cancer. And in general, and when you start studying most of that, different cancers, you'll understand that healthy immune system will fight off cancer cells. And using heat and energy certainly makes a difference at that cell level, whether it's cancerous cells or injured cells or whatever the case may be, being able to not allow those cells to grow as well, not allow those cells to replicate as well, and allowing the body to fight them off. You're also opening up pores, and when you heat up things like that, you're really opening up your whole system to get rid of toxins, and boost your antioxidant level. I mean, that's really what you want to do, is get rid of that oxidation process and allow your body to recover and to fight and help those T cells and B cells. So.
And what's key about what we're talking about here today for the listeners is that you're sharing this technology that allows the body, or what should we say, assists the body in doing what it does naturally, in other words.
Yes. I believe very strongly in enhancing the body's ability. We are not living as long as we should today. We're not living certainly as healthy as we should today. We're getting disease and illness much earlier in life than we should. And you study other cultures and you study other countries, and we're near the bottom in longevity in our country. Yet we live in the greatest country in the world, and we have more clinics and doctors and nurses and prescriptions and anything per capita than any other country in the world. Yet we're near the bottom in longevity, and we're near the bottom in life expectancy. And certainly that means all that sums up quality of life. And I also think we're certainly at younger ages, and kids today aren't near as active as they need to be. And even adults, you get in pain and you get arthritis, you get something developed, diabetes, whatever the case may be, and it's easy to not have energy, and it's easy to be in so much pain that you just want to sit around or lay around. But the body can't heal in that state. It needs activity. It needs you to boost it. It needs you to create that energy and that movement. And low-level laser really enhances all of that. And it's moving cells, and it's releasing muscles and increasing circulation and can really benefit the body anytime during the day and night. And that's the great thing about laser. It's simple. It's safe. Infinity wearables that we have today are just so easy to use. Turn them on and put it on and go about your day. Go on your walk, go on a bike ride, go play golf, go whatever the case may be, go watch a ball game or sit while you're watching TV or go out to dinner. Anything you do, you can use true laser today, and that's what the Infinity wearables, what we finally got our hands on and a hold of and help to continue to help develop today so that people can stay active. I believe very strongly, stay active, stay healthy. And that goes for kids all the way up to if you're 100 years old. And I believe that very strongly, mentally and physically.
Now, I know that this is probably fantastic for people who are athletic, like sports, and I'm sure that it's probably a more enjoyable alternative than liquid heat.
Sure. Yeah, anybody in athletics, I've played a lot of sports and played some amateur and semi-pro baseball for a number of years, and have 3 young boys that I coach and play baseball with as well, and they've used it since they were babies. There really isn't an age to laser. Obviously, when you get into class 3 and things like that, you want to be careful on the power when it comes to babies or things like that. But certainly, class 1 and class 2 is safe to use anywhere, including with kids, and shoulders or bumps and bruises, scrapes, things like that can all be very beneficial. And being active, when you're whether you're on the golf course or on a baseball field or on a soccer field or whatever, bike riding or whatever, the less pain you're in, the more you can perform. And the faster you can heal and recover from major exercise or major performance, the better off you are, the better you can get back to optimal performance again and to an elite performance. So tremendous for athletes, especially having wearable technology now, where everything used to be iced. It was always ice, ice, ice. Well, we know that that's not necessarily good all the time today. You certainly want to use warmth and heat and increase circulation, not decrease circulation. You want to reduce swelling, but then you want to increase the blood circulation so you can actually heal.
Now, here's one for the listeners, too. We can move this technology to be able to help with our pets as well. Is that true?
Yeah, low-level laser has been used for many, many years in the veterinary and pet world. And, animals respond so well to energy. We're all energy beings, and we respond very well to energy in many forms. And low-level laser is really, in the energy field, and using that to enhance, whether it's a dog or a horse or whatever, ability to recover and heal from a injury or illness or whatever the case may be, can be very, very beneficial. Your animal, your dog, your horse knows if you're sick. For instance, they can sense that. They have that energy about them, and using low-level laser on them can be extremely beneficial, not only for treatment, but for prevention oriented. And so we see that very, very often and have for many, many years.
Now, what's incredible, and in a minute I'll have you give out your website so people can discover more about this, but I'm on there and I'm taking a look at this horse with a pretty bad injury. We're talking like something tore something out of its skin, like on its leg, and they actually used this lower-level laser technology on a wound.
Yeah.
Really? Yeah. That's interesting.
Anytime wound healing in general, using light therapy can speed up recovery anywhere from really 2 to 10 times the speed. And a couple of reasons why. Number one, you're increasing the circulation back there. You're, number two, reducing the inflammation. You're also helping to keep out bacteria. Bacteria doesn't necessarily like light or heat for that matter, as you've even mentioned earlier, and certainly visible light for that matter. And so you're doing all those things. You're helping better oxygen by getting increased blood flow, so the healing time can be significantly reduced. And if you can keep bacteria out of there or infection, or if there is infection in bacteria, and get rid of that quicker, your healing time can be cut minimum in half, if not much quicker than even that.
So for all you people out there who love skateboarding, this is something you might want to think about.
That's right.
So if you could, for us, give out a website and tell us what people could expect to find there.
Yeah, they can go directly to our site, which is infinitywellnesslaser.com. Again, infinitywellnesslaser.com. And they can really go through. Everything is kind of put in there in great general terms. There's a brochure they can download right themselves. They can email us directly, and we can send them a packet of information as well, or call them and consult with them. And they can go on there under whether it's sports or even a professional, or obviously the general consumer, which is our main focus, is the home. Infinity wearables are really designed not only for a professional to make sure they're enhancing their physical therapy or their chiropractic work or massage, but really 90% of what we do is to the home, because you can use it every day, and you can use it at your convenience and in between everything you're doing. And so it's, again, infinitywellnesslaser.com. They can do that, and also have a phone number they can call if they'd rather do that as well, and get a free information packet that I can give to you as well.
Well, very good, and it certainly sounds like it's something that you can actually use this technology whether you need to or not, because it's going to just kind of enhance things one way or the other. So it's kind of a win-win all the way around, isn't it?
Yeah. Prevention is really the best form of medicine all of us should be in, and staying active and staying focused on our health on a daily, weekly, monthly basis. If we had that as part of our routine and part of our life and focus, all of us are going to be healthier in some way, shape, or form. There isn't anybody that I know that can't work on their health and wellness, and certainly prevention is key. And
Ronnie, I completely agree with you. I don't know how many times I've hammered that away. It's, look, guys, you're responsible for your health. Don't pass it on to your doctor, get upset with those alleged greedy pharmaceutical companies.
Right,
it's up to you.
Right.
But, it's really amazing, too, real quickly, is that here you've got this technology. It's been around a half a century, but it seems to be one of those things that, only now you discover this. It's, for instance, Years ago, as we first started our show, right around, I think it was 2004, 2005, I did an interview on this, what could be called a passive form of exercise, where you wrap these large cups around the thighs of your legs, and they attune this with your heartbeat. And what this does is it causes pressure to the heart to regrow new blood vessels, you know. And what that is for is people who have, you know, things like heart disease and so forth, that actually, or blockages in the heart, it helps regrow around those. So basically, here's this, you know, treatment that would run you anywhere from $3,000 to $5,000 to help to heal this, you know, which is a heck of a lot better than the alternative, which is surgery or medication.
Right. Absolutely.
And it's been around since like the 1960s.
Right.
So it's pretty amazing, and we love bringing things like that up here for our listeners. And I think that people are becoming more proactive in their health, in the realization that our healthcare system really is broken down. There's too many middlemen in the way for us to access and get what we want. So here's a proactive way for people to be able to do that for themselves. And if you could, Ronnie, give out that website one more time.
You bet. No, I totally agree. And being able to create that active, healthy lifestyle, I think, with low-level laser and other natural products is really, really important. And our site, again, is infinitywellnesslaser.com. Again, www.infinitywellnesslaser.com. And they can go there and request information, request a consultation, attend a seminar. We do some events and seminars around the country. If they're in an area that we're going to be doing a small group demonstration, they can do that. And they can see the different lasers that we have and the different wraps and everything on there. So, again, it's infinitywellnesslaser.com.
Very good. Ronnie, thank you so much for coming on the program and telling our listeners about this marvelous technology.
You bet. No, appreciate it. It's great to talk to you guys, and look forward to a lot of healthier people out there.
And a Happy New Year to you as well.
Happy New Year to you.
You bet. We want to thank you, the listeners out there, for joining us. You can also discover more at beyond50radio.com. That is the number 50. We do encourage you to sign up for our weekly e-newsletter as well. That's where you'll discover things like this amazing technology of lower-level therapy. I'm Daniel Davis. Thank you for joining us. You've been listening to the Beyond 50 Radio program. Follow us on Twitter at Beyond 50 Radio as well as Facebook. Again, thank you for joining us. And remember, live your day past halfway.